This is AirSENCE. It's an inexpensive portable air quality monitor. Inside it has 14 sensors that measure concentrations of 5 key air pollutants: nitrogen oxides, ozone, carbon monoxide, carbon dioxide, and particulate matter, which is one of the air pollutants most strongly linked to negative health effects. The device transmits information on all these pollutants, and the AirSense data engine can also translate this into an overall measure of air quality using the Air Quality Health Index scale. We began developing the AirSense prototype around 2011 as part of an AllerGen-funded project at the University of Toronto. We've come a long way since that time, where the early versions were actually in a Tupperware container, and now we've got versions that can be carried, can be put indoors or outdoors. But at the present time, our focus is on the outdoor version, working with a Canadian company called AUG Signals, and the goal is that we'll have this for sale within Canada and internationally in the not too distant future.
There are many public health applications for AirSense. For example, we used AirSense during Toronto's 2015 Pan Am and Para-Pan Am Games to collect air quality information near the athletes' venues. We've posted the results online so that visitors to the game, especially those with allergies, asthma, and other respiratory conditions, could make decisions about when and where to train, sightsee, or schedule their activities. We're just wrapping up a 3-year collaboration with Peking University, where we evaluated AirSense in Beijing, and we'll now be deploying devices in other cities in China. AirSense is also involved in the City of Toronto's King Street pilot project. King Street is the busiest surface transit route in the city, moving more than 72,000 riders on an average weekday. The pilot, which began in late 2017, is altering traffic patterns on the stretch of King Street from Bathurst in the west to Jarvis Street in the east. Cars are not allowed to move through intersections, and they're being rerouted to side streets throughout the area. The goal is to speed up streetcar service and to prioritize cyclist and pedestrian traffic over cars. We thought this would be an ideal opportunity to use AirSense to track current air pollution and changes in air pollution in the King Street area. So we are collaborating with both the City of Toronto and the Toronto Transit Commission. We installed AirSense monitors at a few selected locations in the pilot area. We are also attached sensors on 2 TTC streetcars so that we can continuously monitor air pollution levels along the street. Our team took air quality measurements on King Street last summer and fall before the pilot started to use as a baseline. The data will allow us to compare the air pollution exposure of people traveling along King Street and nearby areas, both before and after implementation of the pilot project, to answer questions such as: has the pilot had a detectable effect on air pollution? Are cyclists on side streets being exposed to more air pollution because cars are being rerouted there?
Right now we're working with other departments at the University of Toronto, Ryerson University, and members of the Canoe Consortium to look broadly at changes that are occurring around King Street, such as noise pollution, air pollution, or how the population is using the mass transit, to look at issues of whether or not they're walking more or less as they use the streetcars. The results from this work are expected to come out in the fall of 2018.
We are also using AirSense in a number of other research projects, such as measuring how much air pollution GO Train and Via Train riders are exposed to, and the impact of the Kilauea eruption in Hawaii on the air quality of villages located near the volcano. We are pleased that the investment AllerGen has made to support our work over the years has had such important impact, including the training of new professionals who have had and continue to advance the AirSense project.